So we'll proceed to the workshop number 2. Also a very lively discussion, beautifully organized by Professor Loreto Carmona and Marc Lange. So we'll be pleased to hear it.
Okay, so first of all, eHealth is meant to help people, not to get in the middle. So that's one of the key important messages here. And another thing is that eHealth is just a part of the process of care, not the objective. Not the aim is not to use eHealth, but to include it in the process of healthcare. So which are the issues that and the barriers that are in the middle of the developing of eHealth technologies in cross-border care? There were 4 of them. Well, there were many more, but we focus on these 4. One was the lack of maturity of the systems. The health technologies were not completely mature. I will explain later. The regulation was underdeveloped yet. There is limited evidence on the processes, on how they work, the eHealth. And also there are some contradictions in the policies that actually do not really foster the eHealth. So what do I mean with each one of these? The lack of maturity of the system, it means that the systems, the eHealth systems, are centered on the managerial data more than in the patient center, or they are not doctor center. So they are used for the hospital, but not for the care in reality. Also, they add a lot of complexity when nowadays we have less time for the encounter. Another thing is that there is a danger to become too technical, like we are measuring too much. Maybe we are making us ill by excess monitoring. So we have no idea whether this is due to the technical hurdles or of the system. So we think that the systems are really not mature. They're not adapted to the reality. The second challenge was the underdeveloped regulations. So we need a common technical language, both for the technology, but also for our terminology. There are also different legal frameworks in the different countries for the access and for the use of the technology. And also, somebody said that it's true. The eHealth technologies are not regulated as the medicines are, for instance. And in true, we are using them for health. So they should be regulated up to some point. And also because we have many, many different health technologies that we can use, which one is the one that it's really validated for its use in humans? Maybe it's just a waste, or maybe they are unsafe. We don't know. The 2 other challenges were, first, the limited evidence on processes. There are very few studies, at least in our field, that really can tell you which health technology is used for, or which eHealth center process is used for or not. And also it's because this is an evolving field. It's still under development. And finally, the challenge that we wanted to point it out when saying that there were contradictory policies is that the whole system is saying we want to put in the center of care chronic care and home-based care, but at the end of the day, it's just all about new hospitals, and it's all about acute care and paying more to the people who is developing this acute care. So this is what we say by contradictory policies. So how do we tackle the lack of maturity of the system? So we propose that at the EU level, we really like the vision that the EU has in this point. So we said, okay, we like your vision, implement it. So we are asking the EU to please develop ways to implement their own vision. At the member state level, we actually want them to get involved to reinforce the use of eHealth technologies, the good eHealth technologies. And at our level, we need to enable patients and clinicians to get involved in the definition of the needs, because many of these technologies are designed without the involvement of the actual users. Then, regarding the underdeveloped regulations, we want the EU institutions to develop common communication standards. We think this is critical in order to use the eHealth technologies throughout Europe. At the member state level, they had to commit to these common standards. Otherwise, it will be no use that they develop them. And at our level, we need to advocate for the implementation of standards. So we all have to be aligned to the common standards. Regarding the limited evidence of processes, this is at the 3 levels is basically more or less the same. Is first at the EU level benchmarking of the good practices at the member states, which one are actually doing well with the eHealth technologies. And also we want the EU to develop instruments to implement eHealth. We don't know how to bring all these good ideas into down to earth. At the member state level, to commit and to support eHealth, both the research and the implementation. And as we want EULAR, or the organizations at the European level, to foster eHealth research, but also the implementation of eHealth technologies. Finally, regarding contradictory policies, it's all about alignment. What do we mean by this? At the EU level, we want then to promote the alignment of policies across health problems. When a cardiologist and rheumatologists are talking together, one will say, we want more acute care. The others will say, we want more chronic care. We want them to talk together, not in different silos. Okay? And also to involve all the stakeholders in the alignment. At the member state level, we want the system to get aligned to the vision of moving care from the hospital to the home. I mean, if they think this is the way to go, please align to your own vision. And we want them to involve all as the stakeholders in the alignment. And then at our level, we have to advocate for following the patient and not the institutions. We really want these eHealth technologies be developed for the patients and not for the institutions. And I think this is mainly what we wanted to say.